A lot of people want work experience. They will phone you, they'll email you, they'll constantly be on your case. And, we want to do it, but it's just so hard for us. We can't really put them in a consultation room. They can't really watch patients. It's just something that they want to do. And we can't do it. So obviously, people who live in the area, you're going to know maybe your family are registered here, your aunts, your uncles, everyone, you probably end up knowing someone and, accessing, when you're working here, you've got lots of screens, you can kind of see things. So that's a problem. That's a problem we face, that we can't have patients coming in for work experience. And how many sometimes you don't even know where your family's registered, right? Also, like, if you're asking patients, like, are you okay with someone coming in, and generally people who come in for work experience are 16, 17, they don't feel comfortable. They find it a bit weird, someone sitting in a consultation with them. I think people are happy to speak. People want to speak about their roles. They want to talk about what they do. They want to share their personal stories of how they got there, but it's just doing that, wrong place, wrong time, just doesn't work. No one's thinking about work experience, but at the same time, you have a workforce crisis. So I think people should start thinking about it. It is really important. So we are only one GP practice. And, we talked about people coming in for work experience, and, you probably can just about handle once a year, maybe. So we're changing things around. We're providing this online work experience program. We've done this for about 2 years now, where we do a 3-day program. People get to, meet different staff members, so clinical, non-clinical staff working in the NHS, physician associates, clinical pharmacists, GPs, care navigators, managers, and you actually spend time, you get to speak to them, they talk about their roles. They share their personal stories, how they got there, and they talk a bit about what they do day to day. So we have the, day in the life videos, which, you get an insight into what they do day to day, and understand about the different clinical areas they work in as well. So, our healthcare assistant, for example, she could talk about, doing ECGs, how it works, some of the common questions she might get. So you're getting an insight into that specific service that you provide as well. You're doing the online programs, and we usually run them during half term. We've been using that time to kind of test different ideas out, but around 3,000 we've managed to reach. On each occasion, I think we've managed to get about 400 or 500. People, honestly, they appreciate it so much. That's all they want. They just want an insight into how the NHS works. They want to speak to people. They want to know what it's like, what the different roles are. The amount of people that came on and said, I didn't know these roles existed. I didn't know that, and I felt, they felt like there was a place for them. There was people there who wanted a career change. So they wanted to know about, what the options were. We mentioned admin roles within the NHS. A lot of people still have that mindset that it's just GPs and nurses. So feedback was amazing. People really kind of valued it. We open up the chat. So these are live sessions. So we open up the chat, people ask their questions and we answer them live. We have fun. We have fun during that, and we ask them questions and we do polls. And we actually get them to do a social media project. So it's all finding work experience, and, you can listen to someone, but actually going away and doing something. So what we did is we asked people to either write like a blog post about their experience, or do, capture one area that they found really interesting and making that into a social media post. And we gave them tools that we said, you could use this platform. These are the different tools you could use. And people went away and produced some amazing work. Actually, one of the people who attended submitted a bit of work, and she actually works with us now.
Yay.
So, some amazing work. And I think this helps people with their, when they're going, when we talk about, reflection, it's so important. We tell people that when you're here listening to these roles, really reflect on it. And, this is going to come in handy when you're going to your interviews and you're writing your personal statements, to mention that this is what I did. And actually, I didn't just go and attend a 3-day, online work experience program. I actually did this bit of work, and here's the work. So we've kind of, like I said, we kind of tested these things out, and a lot of the things became repetitive. And I know people wanted the content. So everyone would be like, where's the recording? I missed this day, I missed that day. what we've done is we've bundled up everything in an app, so an exclusive app, and we're giving people access to this for a week. Now, within this app, you've got the different roles that we talked about within the NHS. You've got all the kind of top tips that they give you. You've got the podcast, you've got the recordings. You actually get to play games as well. So there's, games like, is it Space Invaders, quizzing? I don't know what it is. But anyway, some fun games that you get to play and some quizzes to actually test your knowledge, because I think it can be quite a lot to take in. So actually answering those, playing those games, answering those questions. You get to see how far up you are on the leaderboard as well. And we also give access to content around the different clinical areas. So like diabetes, asthma, mental health. We are doing webinars on those topics as well. So people have access to that content to understand what those areas are, how it all works, how we do the reviews, which is really useful. You only have access to the app for a week. So you only have 1 week access, and actually you can download a certificate as well. So you can go in, you get a PDF, it'll have your name, it'll have a list of all the different modules you've completed, because we do get asked that a lot, can I have my certificate? So you can get it, you can download it yourself. So you've got the different clinical roles, and then you've also got how they apply that in a clinical setting. Anyone can join. So it's completely free. There's no charge at all. You can sign up as long as you're over 16. Anyone can join. So not necessarily, it doesn't have to be, even if you're not interested in healthcare and you just might want to know how the NHS works, join.